Hi everyone, my name is Dr. Christine Anderson. I also am known affectionately as Dr. Chris by my patients. I am a chiropractor who works in Los Angeles for over 30 years. My specialty is pediatrics and pregnancy, especially brain-based chiropractic with a focus on functional neurology and childhood developmental disorders. I know that's a mouthful, but what it all boils down to is I am concerned about children's health from the start of conception through pregnancy and birth and through the years, and especially with the development of their nervous system, which is why I was doing this series on autism. This is the fifth in the series, and if you haven't seen the other ones, go back and watch them. And I wanted to come on and do this sort of bonus episode on the red flags that you might see to alert you that there's something going on with your child's brain or nervous system in their development. Now, they may or may not have autism with these red flags, but it's an alert that something is going on. And then the earlier that you get it taken care of, the better. As that brain develops and as things become more cemented and habitual, especially after the age of 10, it's so much harder to make these brain changes. And you can make brain changes because there's nothing wrong per se with the brain of a child with autism. It's more about the connection. So to learn more about that, go and watch some of the other videos. But this really makes me this is what it's really all about for me. Even though I can help children who have already been diagnosed with autism, to me, getting to a child before these issues even really cement themselves, okay? They just have some red flags or some issues going on. For them to get help early means they may never get a diagnosis of whatever. All right, let's dive right in then. So first, I just want to talk a little bit about developmental milestones, because this is something that really gives you a window into a child's neurologic and brain development. You're going to see certain things like behaviors, things with social, things with emotional, cognitive. So there's certain benchmarks that children are supposed to hit at a certain time. There is a normal range, and these are not arbitrary. So when I hear things like, oh, this medical professional said just to wait and see, or they're going to grow out of it. Maybe not. But what are you going to wait and see for? If there's already red flags that a child is not meeting their milestones, that's a message that there should be some intervention sooner rather than later. So this is really what, when babies come in, I'm looking at, as well as a number of other things, but this is really, really crucial, and you're going to see in a moment what some of these milestones are, particularly with autism. So to start off, the social smile or the laugh happens really quite early, and this is in line with a baby's brain development because the right side of their brain develops first, and that's the side that is concerned with social, emotional development. So usually babies are smiling by 7 weeks, 8 weeks tops. No longer than 2 months. This happens really, really early. And as you can see there in the little picture of that baby, you can tell when it's a social smile. His eyes are engaged as well as the mouth, so you know that it is not a reflexive thing, and he's looking directly at whoever is holding him. So then they start to laugh at about 3.5 months, and really there's nothing better than a baby's laugh. So if your baby is not doing this, it is a signal that something is going on, and it may be an early red flag for autism spectrum disorder. And this is especially if the baby doesn't want to look at you, is avoiding eye contact. He or she doesn't like to cuddle. They don't like to have social interaction because remember, their brains are wired at this point to have this social connection. So if they're not doing it, something is going on. The next early milestone is also babbling. And this can start at about 2 months with babbling of vowel sounds. So, ooh, ah, they're just moving their mouth, air is coming through, and it's the start of language. And then about 5 to 7 months, you're going to hear more of the consonant sounds. And this is where you might get ma, 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 da, 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 da. It's a repetitive sound that they usually make before it becomes a cognitive sound where they know they're saying mama. And they're also getting that feedback. So if they're saying ma, 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 and mom is right there, of course she's going to be like, yeah, mama. And so they're going to get that feedback from the people around them when babies start, talking, so that they see, oh, when I make these sounds, I get a certain response. So it is a type of bio and neurofeedback. Now, if there is a complete lack of babbling, that baby is not making sounds. And especially if this is by 12 months when they should be saying their first words. So the babbling is the warm-up for speech. So typically you don't have a baby going from saying nothing, no babbling, to talking. It's a progression that usually occurs. So this is another sign, another red flag that a baby is headed for a diagnosis of autism later on in life. Now, I will say another aspect here. If a baby is not talking, is not babbling, then this is a time too to get their hearing checked. Because if they're deaf and they don't hear sounds, then oftentimes they're not going to make sounds because then they can't hear it. So you want to rule out deafness or hard of hearing in a baby who is not making any sounds, any babbling. All right. So responding to their own name. So usually by the age of 7 months, you can say a child's name and they will turn and look at you. Or if they don't know, they'll be like, how do you know my name? Like they give you a look, right? And there was actually a study done by the UC David Mind Institute, April 2020, Archives of Pediatrics and Adolescent Medicine, that found that year-old babies who do not respond to their own name are more likely to be diagnosed with autism spectrum disorder or other developmental problems at the age of 2. And that's really, again, quite early. So this is, again, something to look at. Is your child responding to what's going on in the environment, and especially to their name, which they should know? Let's move on. Receptive language. So this comes very soon after, 8 to 12 months. And this is when babies are responding to what you're saying to them and responding to simple commands. So babies are going to understand way more words than they can initially say, right? So you can ask them a question and they might, say no or yes, or they might even sign if they've been taught some sign words early on before they're speaking. I'm not a huge advocate of a lot of sign words. I do really like when babies are trying to sound words out. But a few hand gestures can go a long way so a child doesn't get frustrated. So, of course, things for yes and no, more, it really can help. But anyway, that they understand because you can say things like, go get the ball or go get your shoes. And, they may crawl over or walk over depending on their age. And they will do the command that you are asking them to do. This is when they start to use the parts of the brain that associate words with meaning. Now, if they have a receptive language disorder, then they're going to have trouble understanding and processing words. It's like that you're speaking, but the parts of the brain that they need to put those words into context and understand them and comprehend them is not working so well. Um, so they're not connecting what you're saying with the meaning. And they may tune you out when you're talking to them and just, they're sitting there doing their own thing in their own little world and not really following any directions you might ask them to do. And this is definitely something that could be a red flag and associated with autism spectrum disorder and also other developmental issues. So not just only autism. Imitating gestures and mirror neurons. And this usually occurs about 12 months. And this is where children are deliberately copying physical mannerisms. And of course, they're going to be waving bye-bye and shaking their head for no. So they're seeing this happen and they will imitate it. And they may also start to use objects correctly, like drinking from a cup when they see you do it, brushing their hair, dialing a phone when there always used to be dial phones. Now it's more tapping a phone. Putting the phone up to their ear, although you guys shouldn't be doing that now with your cell phones. That's the old style, old time phones where we used to have to put the receiver up to our ear. Oh my goodness. So these mirror neurons are present at birth. And I go into a lot of, in the previous episodes, go back and watch because I talk about the sensation of when neurons, which are brain cells, when they fire together, they wire together. And so when you're looking at another person doing something and they're acting, then your own brain neurons will fire as they're doing that action. So it's one of those things that is a precursor to empathy and even language and socialization. So you can actually, this is where you start to put yourself in someone else's shoes, that you can start imagining what they're going through. Obviously that comes later, but this is the start of it with these mirror neurons. And there is a broken mirror hypothesis of autism that explains why some of the behavior they do exists because of this lack of mirror neurons or lack of connectivity in mirror neurons. Okay, pointing. This is a big one. So this one is where a child sees something and they're like, ooh, ooh, and they're pointing, and usually they want a response from you. You might say a name. It's like, ooh, ooh, that's a dog. Or they're pointing to something they want. Yes, that's a ball. Do you want the ball? And so, as a parent, you find yourself basically having a 24/7 narrative going on before your children talk. It's very funny because you don't even think about it. At least I didn't naturally. It's just a monologue of everything that's going on. Oh, we're going to put your shoes on. Okay, let's, which shoes do we want to wear today? And you're just talking. You're in the grocery store going, oh, should we have broccoli today or should we have cauliflower? And this is, way before they are actually speaking back to you. But they're hearing the language over and over and over again as you're speaking. And this is the way of them to co-opt your attention and have them direct your attention to something that they are interested in. So this is really, really important. If there is not this pointing and wanting your attention, this is really one of the huge red flags of autism. So just take note of that. This should be happening by 18 months. And this is especially important if they're not making other gestures of giving and showing. In other words, they want to co-opt attention. They're just not mindlessly pointing at something. It's really to get your attention. Now we're at imaginative play. This is around the preschool years, 3 and 4 years old, where you see little kids and they're in, pretend kitchens or a pretend store with a little pretend cash register or something like that. Or if they don't actually have the items, they will pretend something else is something. So it'll be like, pretend this is, a phone and you're going to talk to so-and-so, or pretend, I'm the mommy and you're the little kid. So there's this whole imaginative aspect of the brain going on, and they start to switch gears around age 2 to 3 to the left hemisphere, which is more of the linear aspect, but they still co-opt the attention of the right hemisphere, which is definitely imaginative play. And what this really does is it's a social aspect of working out their emotions with reenactment, helps them to be heard because they will often express things that they don't know they're feeling in what they're doing as they're playing. And it also is a time to work with other kids, like you be this one and I'll be this, or, I'll do this and then we can take turns doing that. So they learn these very important social skills by acting out imaginative play. Well, kids on the spectrum really prefer to play alone, or they'll be in a room with other kids, but they'll kind of ignore them and won't really involve themselves in it. Or they'll hang out with the adults because they don't know what to do with kids their own age. Sometimes they're even disdainful of kids their own age or afraid of kids their own age. It runs the gamut, but it is not, usually you see kids and if they're little kids together, they want to play together. And that just doesn't happen if there is this red flag of autism. Now, I've got some other warning signs here as this last red flag, just because you want to kind of keep these things in mind. Number one, if there is any regression of milestones, so in other words, a child has started talking, has started walking, that type of thing, and then they start to regress. Now, we hear this happens quite a bit after vaccinations, and you will hear, at least I have heard, a number of parents stating that. They were doing such and such, they were on the road developmental-wise with their milestones, they went in for a shot, or maybe it was their second shot. It doesn't have to be the first, it can be sensitized over time, and they do build up. And kids are getting way more vaccines now than they ever used to after the 1986 Act. So starting about 1990, the vaccine schedule became overloaded. I believe now there's over 76 doses of vaccines that children are given at a very young age. And we don't know, they're really never been studied to see what happens when we put all these vaccines together. And they've actually never been studied. The schedule has never been studied. Like, we have to give the vaccine at this time for it to be effective. It's just an arbitrary thing that's been done. And we could go into more about vaccinations, and I really do want to cover this topic, but I don't want to bog it down here. But this is what I hear in my office, and you hear in other places where there is a regression of milestones. So something has gone on with brain development. And it's often after a vaccine or some other traumatic insult, something like that. Now, also, if there's any issues as a newborn or an infant, so I'm even talking about issues with breastfeeding or arching or babies crying excessively, because those are signs that the nervous system may be involved. And how do we know long-term what these things turn into? So in other words, a baby that's arching and uncomfortable and can't be consoled, maybe it's because there's something going on with their craniosacral system that's affecting their brainstem, which is where primitive reflexes are, and we need those for our brain development. Hopefully you get the idea with that. I do talk more about this in other episodes, and I will be doing an episode specifically starting with primitive reflexes. I believe I'm going to do that next week. Kids who are just staring off in space are just not really with it. They're just somewhere else. They're on another planet. Or they might rock their body or flap their hands or do some other repetitive motions. This is another red flag that autism may be an issue. Echolalia, where they repeat words over and over. You say something and they repeat it back. They might be lining up their toys, which isn't necessarily an issue. Sometimes it's a developmental phase. It's more of an issue if they line the toys up and you cannot move them out of that line. Like they will have a full-on meltdown if you move any of those. They might focus on unusual objects or like YouTube videos where they are obsessed with like watching YouTube videos of toilets flushing or, whatever. It runs the gamut. I've heard quite a few things. Frequent extreme meltdowns, meaning not just a normal toddler tantrum, but anything that deviates from their schedule. Anything where you're not giving them enough time to transition. If you say the wrong thing, look at them the wrong way, or you put the wrong color, whatever on them. Like they are just losing it completely. And then aggressive behavior. So this is again a sign of brain or neurologic imbalance, and you definitely want to get it checked out sooner than later, because the longer you let these things go, the more solidified they become. So with early intervention, what does this look like? Well, like I said, early intervention has a better prognosis. It's not really, let's wait and see if they grow out of it. Let's wait and see if it gets better. With the brain, with the neurologic system, if you do not do some sort of intervention, can much guarantee that it is not going to get better on its own. And moms out there, trust your intuition. Usually the moms have this intuition more than the dads. Trust your intuition. Keep seeking answers. I get this all the time where mom's coming in and they're going, I knew something is going on. My doctor won't listen to me. They keep saying, they're okay, but I know something is going on. And of course, I help them out. Now, I am a pediatric chiropractor. That's my DICCP. That's my board certification pediatrics. And I have my certification in childhood developmental disorders, which is my FAB CDD. So you want to find a chiropractor who is trained in pediatrics and one who is also preferably trained in functional neurology. I will put a link to different programs that you can look through to see if there's someone in your area, but I also can help people remotely for a lot of these things, except for the hands-on work. So sometimes I work together with chiropractors trained in neurology and other, or trained in chiropractic for pediatrics, so they're doing the hands-on and then I'm helping with some of the neurology too. So remember, this goes back with early intervention to epigenetics, the expression of the genes, going back to stressors that are physical, emotional, toxic, metabolic, so we want to work on those levels as well. And then, of course, the chiropractic care and cranial sacral therapy, which is super important for the brain connection, top-down control. We want to have all that working well. All right, so as you see here, the little baby there, many developmental milestones, such as learning to hold up the head, sitting upright, crawling, and walking, are all activities that are affected by spinal alignment and are important times to have a child checked by a chiropractor. And this is why I really advocate for having babies come in every single month in that first year of life. That's their wellness neurologic check, all right? Medical doctors weigh and measure, and they will give the shots, but I am checking neurologic development so I can be right on it. If there's any little thing that's not occurring, then we can get on it right away so that it doesn't become a big thing later on to deal with. All right, so what do? I do neurologic assessments. I'm a brain-based chiropractor, and I look at every single level. So depending on how old a baby is, whether they're newborn, an infant, toddler, preschool, or a school-age child, it's going to look a little different depending on their age and what I do. But the basis of it is I'm always looking at their neurologic development and any asymmetries or problems that are going on with their nervous system so they can be dealt with right away for wherever they're at. Again, I'm brain-based chiropractic. I use also cranial sacral therapy. I talk about lifestyle modifications, like what they're doing for movement, what they're doing in their diet, what is their exposure to toxins and things like EMF, not EMG, woo. Bio and neurofeedback are some of the things I use in my practice for the older children, and individualized brain balancing programs. And so this is where it comes in, because each brain is different. There's no set program where a one size fits all. So I hope you found this useful. Give me a thumbs up if you found this to be helpful. Share it with your friends. Go back and watch the whole series on autism. I will put the links there, and I will also put the link to my functional disconnection syndrome video where I talk about the properties of the right and left brain, because this is something that I also do to help kids with autism as well as ADHD and learning issues. Whatever's going on with kids' brains, it can be helpful. So thanks so much, and I will see you next time. Bye.